So now, without further ado, it is my pleasure to welcome today's first speaker, Elizabeth Hanson, Senior Vice President with Ipsos Online Communities. Elizabeth, you have the floor.
Thank you, Ellen. Appreciate it. Thank you, everyone, for joining us today. So prior Ipsos research revealed that 53% of Americans felt mental health was the biggest health problem facing our country today. Using this statistic as a backdrop, we conducted some research looking at generational perspectives on mental health. And some key findings that we will discuss today include financial hardships and COVID are two factors that negatively affected all generations. But each generation had their own unique struggles and ways of coping with mental health issues. Many turned to relationships, exercise, and entertainment, with 1 in 3 using a dedicated resource such as an app to help with mental health struggles. Of those that sought professional help, only about half were satisfied. 70% of our participants believe that there was a stigma associated with reaching for mental health help. And lastly, there's still an unmet need for mental health help. People want more widespread, affordable, and accessible resources. And you can see a quote from one of our millennial participants there on the right. I do believe that there's an American attitude about mental health, that it's something that should be handled privately and mostly by yourself. So we will dig a little bit more deeply into that in our following slides. So how did we conduct this research? We did this research in our syndicated communities. So if you're newer to communities or just not as familiar with communities, you can think of a community as an online club. It's an online club that Ipsos puts together to talk about a specific topic. So in healthcare, it could be an online club of patients that are living with multiple sclerosis. It could be an online club of physicians that treat breast cancer. Outside of healthcare, it could be an online club of people that love peanut butter or all shop at the same online clothing store. But think of it as an online club. So for our research that we're presenting today, we use 2 Ipsos communities, one that is for the general population and one that was specifically geared towards teenagers and Gen Z. This research was conducted in 2 phases, a quant survey and then a follow-up online qualitative discussion, both in mid-October. And we spoke with about 1,300 people across 4 generations, baby boomers, Gen X, millennials, and Gen Z. And now I'm going to turn it over to Corinne, who will tell us a little bit more about the generations that we spoke with. Corinne, over to you.
Thanks, Elizabeth. To begin, we wanted to help you relate to these generations and kind of help you familiarize yourself with them a little bit better. And to do that, we created 4 personas to represent each generation. From left to right, we started with Bob. He's our baby boomer. He was recently diagnosed with arthritis, and to kind of help him feel better in his day-to-day life, he enjoys talking to friends and family. Sarah is our Gen X, and she does have some financial concerns. However, in her free time, she enjoys watching funny videos and kind of lets her loosen up from her day-to-day struggles. Michelle, who is our millennial, has concerns about the future and feels that there is a lack of work-life balance. And last but not least, we have Hannah, who is our Gen Z. She struggles with feeling isolated. However, she does prioritize her mental health and finds it very important. And I did want to note before we move on that these are 4 personas that you will see throughout the presentation. I also wanted to note that while these issues or things that you see in the research may be tied to specific generations, it does not necessarily mean that they are generation-specific issues, and that some of these individuals may just be in that certain phase of life, or previous experiences may have affected them. Overall, when we looked across the generations, people view mental health as an essential part of their well-being. They believe it is equally as important as their physical health, their social health, and their spiritual health. When we asked the individuals how they perceived mental health, one of our millennials actually said, mental health is what keeps you going every day. It's what gets you out of bed, provides you some energy, encourages you to try your best, keeps you doing the things that need to be done, even if you find them tedious or repetitive. With poor mental health, everything suffers. When we asked everyone their current state of mental health or mental well-being, they did perceive it as positive for 51%. However, 49% either found it negative or neutral, with that 32% feeling neutral, 15% feeling somewhat bad, and then 2% reporting it as extremely bad. And then here we're going to look at the generation specifically and how they currently feel. So baby boomers, you can see, are 58% feel good, and then only 15% feel bad. So they're doing really well overall. Millennials, on the other hand, only 39% feel good and 21% feel bad. So they are kind of in the worst position, feeling positive, and in the worst position on feeling negative. Now we're going to shift our focus a little bit on the number one issue that is negatively impacting their mental health. Amy?
Hey, everybody. So one of the questions that we asked to the panel was to select the top 5 issues of society that they believed were having the most negative impact on mental health in the U.S. And across all the generations, financial hardship was the number one thing. It rose to the top. However, interestingly, it was not the number one issue for Gen Z. For Gen Z, that number one issue was a tie between crime and gun violence and social media and online bullying. Crime and gun violence actually rounded out the top 5 in all 4 generations. Interestingly, social media and online bullying were in the top 5 for the 3 younger generations, but not for the baby boomers. For the baby boomers, political conflicts rose to the top 5. Interestingly, also, the baby boomers and Gen Z both had public health threats in their top 5. However, when you look at millennials, they noted perhaps some struggles with healthcare that are more broad. They placed lack of access to healthcare in their top 5. So we asked another question, a follow-up question. We wanted to know which historical or current events, past or present, have had the greatest impact on the mental health of their generation. So what we're looking at is the responses to that question. And by far, COVID-19 was a very common theme across all the generations. COVID was viewed as having, well, as the specific event that had the greatest impact on mental health. However, many others mentioned issues with information overload, constant exposure to negative news, and that also contributed to increased stress and anxiety. We did share a few quotes from the different generations that shared how they have been impacted by COVID, as well as others in their generation. So starting at the top with our millennial, this person said, "I would say the pandemic has slowed us down because the people have lost loved ones, and it also has divided us more than ever." Our Gen X member says, "In my generation, I would probably say COVID had the biggest impact in the past few years. I kind of feel like that was the biggest event for everyone." And then our baby boomer says, "Everything on the news makes me feel anxious. I now turn the news off, but it seems to bombard me wherever I go." So we wanted to know what people feel can be done. What is the one most important thing that you think needs to happen to improve mental health in the US overall? And so this word cloud that we're looking at is the open-ended response to all the responses combined of the people who answered that question. And very interestingly, it spells the sentence, people need more help. And what does that mean? What does help mean? Many different things. We have several bullets over on the right to describe what comes to mind when people are thinking about help. They're thinking about affordable access to mental health care, in numbers, more support services broadly, both medical and non-medical. Lower cost of insurance so people, again, can access and afford mental health care. People need to know where to find help. They need to have awareness of what resources exist currently. And they need to be able to get help when they need it and the moment that it's needed. So it needs to be immediate. And then there were several responses that were more along the lines of attitudes about mental health and the need to change. Several mentioned there being a need for a reduced stigma around seeking mental health care. Many wanted to see more positive role models from people people that they see on TV, people in the media, celebrities, influencers, others that could be spokespeople for it being normal and it being acceptable to be seeking out mental health care so that those struggles can be normalized. So unfortunately, 71% do believe that there is still a stigma attached to seeking mental health care. And this could be for a number of reasons. We did ask folks to explain why they felt the way that they did. And many pointed to having this fear of isolation, not wanting to be singled out, not wanting others to think that something's wrong with you, not wanting to feel like there is something wrong with you personally. And then on the other hand, there was this sense of not really understanding how serious the issue is of mental health. If you have not personally experienced it, or if you don't know a friend or a family member or someone else who's dealt with a mental health need or a mental health struggle, you may just not understand how big that need is and how it is equally as important as other types of healthcare. So now I'm going to turn it over to Corinne, who's going to share all the ways that we learned in our research of how people are coping.
Overall, every generation does feel comfortable sharing about their mental health with friends and family, as you can see in the teal section in the middle. However, I did want to point out that 23% of Gen Z feels uncomfortable or very uncomfortable. And that's really a significant statistic that kind of leaves us an opportunity. When we ask the specific generations about how they cope with mental health, a large percentage of them from every generation really talked about talking to friends and family. As you can see, for the baby boomers, Gen X, Millennial, and Gen Z, for their number one coping mechanism, talking to friends and family is in that spot. When you kind of break it down and look at every generation separately, we notice that boomers and Gen X are much more likely to turn to religion or spirituality. And then millennials mentioned meditation or yoga. And then Gen Z was actually the only generation to mention gaming, which is number 5 on their list. And in the next few slides, Elizabeth will kind of talk about those professional services that can or have been utilized.
Thanks, Corinne. So people were also turning to mental health resources for support, including apps, medication, and counseling. So you'll see there on the left, 1 in 3 of our participants were using apps, nutrition coaching, seeing a therapist, or even emergency services. On the right, you'll see, 1 in 4 turned to OTC medication, prescription medication, or even an EAP program. Now, of those that sought professional help, you can see there in green on the right, less than half of the people that sought professional services were satisfied with those services. Now, the majority were neutral about them, but really that's less than half were satisfied. So that's not great. When it comes to technology, 1 in 3 of our participants were using technology as a resource to support mental health, and within those 1 in 3, 2 and 3 were using technology, and they thought that technology was beneficial as a mental health resource. You can see a quote from one of our Gen Z participants there on the right. Apps have given me tools and meditations and information I wouldn't have known about otherwise. They are easy to use, fast, and not intimidating. Continuing on with technology, generations were a bit divided about whether technology overall had a positive or negative impact on their own mental health. So let's first look at everyone's individual mental health. You'll see on the left there, when thinking about just their own mental health, our participants were split. 26% of the total felt technology had a positive impact on mental health, while 21% thought negatively about it. When we look more closely at just different generations, 2/3 of our baby boomer generation said technology had no impact one way or another. And 1 in 3 millennials felt technology had a negative impact on their own mental health. Now, when we ask participants not about their own mental health, but others' mental health, a little less than half, you'll see 43% felt that technology negatively impacted other people's mental health. And I'm now going to turn it over to Corinne to continue sharing some differences we saw with technology and our generations.
Yeah, when you look at every generation separately, we did notice that there were some differences that emerged with how they view technology overall. As you can see on the left, Bob believes that technology gets in the way of his communication with friends and family. Sarah, or Gen X, kind of seeks out technology as in her free time and looks at it as kind of a way to relax or spend time when she has the opportunity. Michelle views it both negatively and positively by believing that it helps with productivity. However, it does add pressure in her own life and kind of creates anxiety or sensory overload and is a constant work or burnout. And then last but not least, we have Hannah, who grew up with technology and feels comfortable using it. And Hannah feels that technology is an essential part of her life. And in the quote that we have for Gen Z, they say, "It is literally why I have not given up my entire life. Technology is why I am who I am today." And as we continue to talk about the issues that affect our mental health, Amy will kind of dive into those commonalities between the generations and how they cope.
So when you think about all the different things that people are doing to cope with their personal mental health struggles, what are they trying to achieve? What are they hoping for? In the end, across the generations, people said that they want stability, they want to feel support from others, supported from others, and they need to exercise self-care. And these 3 things are paramount to achieving the best mental health that they can. Interestingly, 66% specifically mentioned exercise as having a positive effect on their mental health. And I'd like to share some additional quotes that were expressed by people in the different generations. So our first quote is from a millennial, and this person says, "It's finances that are stressing me out, and feeling better financially would help me feel better overall." Our Gen Z says, "The ones that are going to be there are your friends, and my friends have been doing everything to make me feel better and help me feel better." And the baby boomer says, "I reap mental benefits when I garden and physical benefits when I harvest. Taking time for yourself every day is beneficial for your mental health." But interestingly, it's of course about things that you can do personally, reaching out to others, getting your finances in order, exercising, gardening, other hobbies. But this theme of empathy also came through. And this really is about not only what you can do for yourself, but how people can help one another. And I'll just read this quote, which is by someone from Generation X, who says, "Mental health is having a balanced view and an attitude toward life while striving to be the best version of yourself without stressing out about it. and helping other people along the way with humility, love, and empathy. So that's a really big point too, is that mental health can be achieved with others helping one another. And so finally, what can we do? We've learned a lot through this research, and we've learned some really interesting similarities and differences across generations. These speak to the similarities on what can help for all people. The first thing is increasing awareness. It's very critical that people are aware of what resources exist currently and being able to communicate where they exist and where people can go to access the help. Secondly, is this overarching need to make things affordable. People need to be able to afford the care or it will not be beneficial. So it is important to make as much as possible inclusive pricing structures so that as many people can benefit as possible. And then facilitating access, there's one thing to communicate and to make it affordable, but people also need to be able to practically get to where the support is. It needs to be accessible across age groups, across different communities, across physical, geographic locations. It needs things, if they're services, they need to be scheduled at a time where people are, it's convenient for people who have different needs and schedules in their life. If it's a product, the instructions need to be simple, easy to use, and clear to understand. So as many, again, to reach as many people as possible. And then finally, there's an overarching need to destigmatize accessing, reaching out for help, whether that's personal help or help from another person. This can be done through the use of ambassadors and influencers to help destigmatize the act of seeking help for mental health. And so now I'm going to turn it back over to Elizabeth for a few final thoughts.
Okay, great. Thank you so much, Amy. Well, thank you so much, everyone, for spending this time with us today. If you would like to learn more about Ipsos Communities and how we could help do research for your brand, please reach out to Amy, Corinne, or myself. And we would love to continue this conversation. Please feel free to type in any questions you might have in the chat. Okay, so I see a few questions coming in. Here's one. What are some strategies to promote positive mental health among Gen Z?
I can take this one.
Sure.
So we learned a couple of interesting things about Gen Z through this research. One that comes to mind was the statistic that they don't feel as comfortable reaching out to friends and family for mental health issues and mental health needs. There was significantly more Gen Zers who felt uncomfortable compared to the other generations. So this is a place where we could think about how to promote self-care. They might be especially attuned to products and services that allow people to exercise self-care. And this could be the development of new products as well as messaging specifically geared towards Gen Z to encourage them to utilize these products and how it can help them. Another thing that comes to mind is the fact that Gen Z are the most likely generation to play games as a way of coping with stress. And so any way that products or services could be modeled around gamification could be appealing to Gen Z. And then finally, along the lines of reducing stigma, we do know Gen Z told us that they are consuming media entertainment. So any way to put mental health themes, characters, ambassadors, celebrities, influencers in TV shows and other media, including social media, could go a long way towards destigmatizing and normalizing mental health struggles and accessing care for mental health.
Thank you, Amy. Okay, let's look at some other questions I see coming in here. Okay, here's one. Is there a difference in what HELP means across different generations? And I actually think we looked at that a little bit. Let me go back to slide 10 to help answer, I think, that question.
I can touch on this as well. Thank you for going back to slide 10. I was actually going to reference that slide. But as you can see here, there are some similarities, but there are a lot of differences that I think leads to opportunities for generation specific. So as you can see, the millennials really emphasized the need for access to healthcare, and that was generation specific. And then for baby boomers and Gen X and Gen Z, they all mentioned substance abuse. As you can see, baby boomers listed as their number 2, Gen X is number 3, and then Gen Z is number 3 as well. So there is an obvious need for additional resources in that area. And I think there's a lot of opportunity with that as well. And then lastly, I do think that because of Gen Z and baby boomers, they both mentioned public health threats, which I think was brought up numerous times because of COVID or things like that. There is some opportunity to create messaging around that or different treatment that is available or resources.
Great, thank you, Corinne. Just reading through some more questions here. Let's see. One person wrote, was there anything that surprised you in this research? Yes, there's actually one thing that surprised all of us. It was the level of satisfaction of those that sought professional help.
So I can jump in on this one as well. This was surprising to us, as Elizabeth said. It's a pretty high number that maybe a lot less than we expected to say that they were satisfied. However, I guess it's worth noting that the next highest proportion of responses was neutral. So it's not so much that people have had terrible experiences with mental health support. It's just that they're just mediocre. They're okay. They're not great. And that means that there's opportunity. There's much room for improvement. And we're thinking about why is this? Like, why haven't more people been more satisfied with professional supports? Mental health is a very challenging issue. It's chronic. It's not a one and done. There might be multiple needs layered on over time that people might need. And so if they access one service or support at one time, it may not be enough. And as we saw in our presentation, as we noted, there's so many other environmental and social factors that are happening in the background as people are getting their help. And those factors are there and they contribute to stress and anxiety. And so it is going to need to be a multidimensional solution, but definitely a solution with lots of opportunity to grow and improve. That was a great question. I think we are close to time, so I am going to throw the mic back to you, Ellen, for some final thoughts.
Well, I just really want to thank Elizabeth, Amy, and Corinne for today's really timely and interesting presentation, and thank you all for joining us. That's all the questions we had today, but of course, we look forward to connecting with you directly regarding this research and other research. So please do reach out to Elizabeth, Amy, and Corinne. Their contact details are here. Be also on the lookout for a link to today's recorded presentation. We expect that will come by mid of this week. And there's a few handouts still on the control panel available to you to download in the meantime. So that now concludes today's webinar. Have a wonderful day, everyone.